So we're going to be having some fun today going over safe and effective strengthening mobility exercises that you can be doing whether you've had surgery or you're contemplating back surgery and you just want to build some strength. I'm doing these with Paul today. He's had surgery himself, and we keep going over these exercises because they are effective at building strength and endurance and mobility in the spine. But the details are important because what you're doing matters. And so some people don't think they could do these exercises, but you can as long as you pay attention to your body and the details. And that's exactly what we're going to be going over today with these exercises. So make sure you pay attention and write down notes if you need to. But before we waste any more time, we're going to be going over the exercises. You're going to want to grab a broomstick or some sort of PVC pipe for balance. And then we're going to be using a squat wedge, which we'll go over soon. So set your area up. Let's get ready to have some fun. So the first exercise here is a traction on the exercise ball. Remember how I said mobility? What's great about this traction exercise is it helps separate the space, and while it may only be millimeters of improvement, Paul can feel it, you can feel it, it's going to be feeling good for your spine. So we're going to focus on feel good stuff first, and then we're going to get into the strengthening. So grab your Swiss ball, the exercise ball, you're going to be in a kneeling position, and then go ahead and roll out on it, and make sure you keep your belly on the ball. And what Paul is focusing on here is he's focusing on keeping his head relaxed, his knees relaxed, and once he sets into the position, he kind of just breathes into it. And what's happening here is a separation of the spine. How many times you should do this, it's really up to you. I think Paul has done it multiple times in a day before, and that's completely fine. You can do it once a day or every other day, but whatever feels good for you, just do that. It's not a strengthening exercise, so you can do it for a longer period of time. I typically recommend a minute. And what's great with this exercise is that if you're doing a strengthening exercise and you start to have some discomfort in your back or down your leg, you can come back to this stretch because it's made to make you feel good. There is no limit on how many times you can do it. So feel that stretch. You can rock back and forth a little bit until you feel that lumbar spine start to decompress. While it may only be millimeters of movement, it's safe, it's effective, and it's super easy to do because you can do it in your home. So I typically recommend you do it for a minute or two, as long as not too much blood is rushing to your head and you can tolerate it. Rock back and forth, and this is safe if you've had a decompression or a laminectomy. This is helping create more space in your spine, so enjoy it. So Paul's going to focus here, just kind of go back and forth. He should feel it in his lumbar spine. He should feel this gapping technique. And when I work with my patients, sometimes I'll give them a little extra pressure, but when you're doing this by yourself, just rock back and forth until you find that perfect, that sweet spot of your spine, and enjoy that stretch. So with today's exercises and what you're about to do, we're going to focus on a couple mobility exercises to help loosen things up, to set you up for success when you do the strengthening. So feel free to do the mobility exercises whenever you need to. The exercise ball should be of decent size that you can relax on it. This one may be a tad too small for Paul, but it's okay. This still works. You feel good, Paul? Yeah, good. It should always feel good. This is a feel-good stretch for your lumbar spine. Whether you spend a minute or two there, it doesn't matter. But utilize this exercise and this stretch to your advantage. If it gives you a moment of feeling good, make sure you move on to the next exercise after, because when you look at the research for traction and separating the spine and doing that, best results come when you combine the movement and the traction with exercise, and that's what we're about to do next. So enjoy this stretch for as long as you want, 1 or 2 minutes, but we're going to move on to the next stretching exercise now to help loosen up the hips. We've loosened up the back, we're going to go to the hips, and then we're going to do our strengthening. So go ahead and stand up. You have the opportunity here to either use a PVC pipe or a broomstick, that's what I'm using, or be next to the countertop, whatever you want to do. But this next mobility exercise is for your hips. We're going to open up the hips so you can have a little bit of a stronger stride and a little bit better gait. So Paul here is going to have the stick in front of him. He's going to grab it with one hand, and then he's going to stagger his stance like so. Go ahead and stagger. Perfect. And so not quite that much. Come forward a little bit more. Good. The key here is staying tall. Keep your balance. Switch hands for me. Keep your balance, and you want to make sure that if your right leg is forward, the pull is in your left hand so you can have a wider base of support. Paul's going to focus on staying tall, and it's a mini bend forward, a little lunge forward, so he feels the back leg start to stretch, this area right here. Now, if you've had surgery or contemplating surgery, and just like Paul here, it can be hard to get into that lumbar extension, that arching backwards, but just do your best. Arch backwards a little bit, shift your weight forward, and feel that hip loosening up. Remember, this is a mobility exercise, so do this 10, 15 times, about a 1 to 2 second hold. You're going to see Paul do that now. And he's just loosening up his hips. He's prepping his body for movement and for what's coming next, the fun stuff. And so he's going to be doing the 12 to 15 reps here, a minute movement, focus on being tall and going back and forth. Enjoy those hips loosening up. One question that I always get is about the back heel. That back heel can come off the ground a little bit more range of motion. But remember about the details. It's a small range here. We're not trying to go into the biggest range possible. We're just trying to open up the front of the hip. As soon as you feel that stretch, that's far enough. Now, if you're not feeling that stretch, it's either from one or two things. It's because you're not tall enough, you're not bringing your chest forward and extending the spine, or what you could do is tighten your abs. Sometimes that will allow you to get a bigger stretch into that hip. Feel good?
Feels great.
All right, now we're gonna go to the other side. Now the rod will be in the right hand. It'll be right foot back, left foot forward. Good, and then stagger that stance and lean forward. What's really great about this, and especially my patients who've had back surgery, sometimes there is a lingering leg weakness that you can notice either with your balance or going up and down stairs. You can tell one leg is weaker than another, and that's okay. It's not gonna stop you from doing these exercises or stop you from getting a good stretch. This is safe to do, but it's how you do it that matters. So you're gonna lean forward. He's got perfect form. Paul and I have worked together for a little bit of time now. He's had a decent therapist tell him how to do this stuff. Good. So we're gonna do about 5 more reps and then we're gonna get into the strengthening. When we get into the strengthening, you're gonna need either like something you can elevate your heels on. I use a wedge board and you'll see that in the description because that's gonna allow you to get into a deeper range of motion. If you don't have that, that's okay. You don't absolutely need it. Good, 1 more rep. Perfect. Okay, so before we get to the exercise required with the wedge, we're gonna go right into the first strengthening exercise, which is starting back in the same position we were in, having that stagger stance, this in the other hand, the right leg back, and now he's gonna focus on not only the length of his hips, but he's gonna start getting into the strengthening. So it's gonna be a little bit more of a deeper range of motion, have a little bit of a longer stance, perfect, and now he's gonna dip into those legs. He's gonna bend both knees at the same time. Go down and up. So the key here is it's not about how deep you go into the range. It's about the length of your steps. So utilize the countertop or the PVC pipe or whatever you're using to help you get into a deeper range of motion. A lot of my patients, either before surgery or after surgery, they have decent strength. What they don't have is good range of motion and mobility. So we're trying to improve that. So we'll let Paul here do a few reps, but then I'm gonna ask him to elongate his stance a little bit more, keep his back foot where it's at, but bring that other foot forward a little bit. That's great. So don't focus on going down as much as far as last time, just a little bit of bend in both knees. Right there, perfect. So when we're working on strength and endurance at the same time, we're gonna have higher repetitions. So we're doing 15 or 20 reps here. I know Paul's legs are burning here. He's going to be enjoying how he feels tomorrow for sure, but we want that good long stance so we can improve on mobility. Now, let's say you're doing this and you start to feel a little stuff in your back. Your back's getting tired or you feel like it's having a little bit of a pain. What you could do is either tighten your abs or you can just lean forward a little bit. When you lean forward a little bit, it's gonna give a little bit of pressure off the back. Perfect, 1 more. Good, switch legs. So when you're doing these, since we're working on endurance, you want 12 to 15 reps on each leg. Perfect form there. So I don't know if you guys could tell, but Paul's form is a lot better on this side because the leg that he has a little bit of weakness in is now behind him, so he's not having to rely on it quite as much. Perfect form, Paul, perfect. So he's got a good bend in both legs. We're just focusing on endurance, 12 to 15 reps, and to have long-term change, you want to be doing this 2 to 3 times a week. But it doesn't take much, and he's not going as fast as he can go. He's focusing on his form, slow, steady, and safe. Very good, perfect form, Paul. Could not be happier with it. It looks good. Okay, 2 more reps here. Great. Now, Paul's in really good shape. He's worked really hard after his surgeries to help maintain his strength, range of motion, and mobility, which you'll see through this video. But even if that's not you, that's okay. If I wanted to be a true physical torturist, I would have him do another set on each side, but to save time, I'm just going to have him do 1. But when you do this at home, make sure you do 2 sets of everything that we're going through. Now we're going to be moving on to the next strengthening exercise, which is the squat. So grab your wedge or get closer to the countertop. We're going to be going over how a squat should look and feel. So now we're transitioning to the next exercise, which is the squat. And I'm sure you've done this before, but it's the details that matter. So this is actually an elevated squat. And what that's gonna allow Paul to do is he's gonna go deeper into the range of motion of the squat. So more muscle activation and more mobility in the back. So what you'll see is his heels are elevated, and that elevation in the heels takes out of the range of motion that's required in the ankles, and it allows you to go deeper into the squat. Trust me when I tell you this, it does make a difference. It is safe, but it's gonna change your mechanics a little bit. So make sure that you're next to a countertop or something sturdy that you can grab onto if you need it. Paul's done this before, so we're not going to need that. So Paul's gonna do, he's gonna have his feet, his normal width that he would do for a squat. And now he's gonna go down deep into the range of motion as far as he feels comfortable. Go ahead. Good. Good. And remember when I said slow, steady, and safe, he's going to be diving into that range of motion, slow and controlled, and back up. What he wants to focus on is just going deep into that range and feeling good. Perfect. Remember, 2 sets of 12 to 15 is where you need to be. Perfect. Feel good, Paul?
Yep.
Good. His mechanics are perfect. So when we're doing this squat, he's going to be going into the range of motion. I would correct things if I saw anything wrong, but he is perfect. Don't worry about your form being perfect, but just think about how the back feels. Remember, if you need to do the traction exercise and have some relief in the back or do your favorite stretch through this, that's okay. So go down into the squat and come back up. Because his heels are elevated, he's almost able to get to 90 degrees, and that's really hard to do after you've had back surgery or you're contemplating back surgery. And when Paul and I first did this, it was really, really cool to see his hips start to open up and his legs start to build some more strength, even when he has some of that weakness left over from the surgery. Looks really good, Paul. So 12 or 15 reps. Remember, we're working on that endurance for strength and for improving ability to walk and just stand, and in his lower back. Now, if you're getting really creative, after you get comfortable with this, you can hold the weights if you want. It's still gonna be the same mechanics, but because the heels are elevated, his back stays nice and straight the whole time. Remember, because I'm a nice guy, I'm not gonna make him do 2 sets here, but when you're at home, make sure you do 2 sets of everything that we're going over. Last one here, Paul. Perfect. So Paul had perfect form, head and chest up the whole time. Your first time doing it, don't be upset with yourself if you can't go down as far as Paul can. That's okay. You'll work into it and it will feel better. But now we're going to move into our last strengthening exercise, which is the lateral lunge. We've worked the hips in the front and back. Now we got to work side to side. So grab that PVC pipe or broomstick again, or get next to the countertop and have some fun. Okay, so we worked front and back, and now we have to work side to side. This is one of the harder ones, especially if you have some weakness in the leg. And you'll see this with Paul here. He has a little bit of weakness in the leg, and so it's going to interrupt his form a little bit, but that's okay. It's still safe and effective. So get that PVC pipe in front of you. He's going to start off here by taking a large step to the left and then bend the left knee while keeping the right leg straight. Go ahead, Paul. So it's to the left, bend the left, and come back. Perfect. Now come to the right, step to the right, bend the right. Yep. So the key here is bending one leg and keeping one straight. Perfect. So he's focusing on, over time of doing this for over a few weeks or so, you're going to notice that your step length is going to change. It's going to feel better, but at first it's going to be tight into the hips, and that's okay. It's safe for the back, it's safe for the hips. But if you've had any type of PT or back stuff, you know that the hips are important. You have to loosen up the hips to get what you want out of the back. So he is stepping here. That foot that is going out to the side, don't worry about the angle of it. If it's straight ahead or off to the side, I don't really care. It doesn't really matter. You're still getting into the hip range of motion here. So he's going to be doing 20 reps, which is 10 on each side. Remember, if you're doing this at home, do 2 sets of this back to back with about a minute rest, but he's going to be doing just 1 set here. And so the PVC pipe there is just for balance. He's keeping a relatively low amount of weight there because he wants to focus on getting into that range of motion. Good. Scoot back a little bit for me, Paul. Yeah, there you go. To the left there. Good. And then to the right. Perfecto. So you guys get the gist of it. Focus on increasing that length over time. Use those 5 exercises to help improve not only mobility in your hips and back, but also your strength of your hips as well. And so Paul and I had some fun today. If you have any question about those exercises, make sure you leave it underneath the video because it's important to get those questions answered. But these 5 exercises should set you up for success whether you're having surgery soon or you've had some lumbar decompression or laminectomies in the past and you're looking for some ways to build your strength. So use these exercises for what they're there for, but make sure you ask questions because it is important to get those questions answered. But as always, guys, stay healthy, keep moving, and take care of yourself.